My name's Lord Victor Adibawali. I'm going to talk to you about communication. Communication's critical. It saves lives. It can make lives better. It can also do the opposite. It's not just about listening, it's evidence that you've been heard. So whether they're a clinician, psychologist, they have to be sharing their knowledge with you so that you can make decisions together and go on this journey. I think it's really important that you watch this film. It's an opportunity to learn and apply that learning in your work to improve the experience and outcomes of BME cancer patients.
When I was diagnosed with breast cancer, I was immediately referred to the breast cancer nurse. You know, one of the things was that she said, yes, if you need support, I'm here. And then after that, I didn't see her. I remember one day I phoned because I was a bit concerned that I had pain in my hips and worried that the cancer had come back, and it was, go to your GP. The breast cancer nurse should have been someone who I felt very comfortable approaching and didn't end up feeling like I was being a burden on the occasion that I did call her.
Dojke, da oni nisu nju da pošalju, da snimi se, da vidi se šta je, kako je, zbog čega je ta bolaviti ruke. Kad je ona otišla na snimanje, već kad je dodijala i tim doktorima i svemu dodijala, poslala sve na snimanje. Međutim, taj snimak pokazuje da je kod nje metastaza. Da ne treba, ne znam, stvarno ne znam zbog čega, što je sad toliko odužilo.
What would make a good experience when it comes to having an interpreter in the room? They would need to understand what we're going to be talking about. So speaking to me first, speaking to the consultant first, speaking to the patient. You don't have the same relationship with somebody if you're communicating entirely through interpreters. So they can talk to the patient after we've finished, but we're still around, so they can then ask us further questions if they need to. So just making it feel a little bit more relaxed, more like a conversation rather than this is what's going to happen.
What she told me was that I'd be very unlucky if I ended up getting prostate cancer. Somebody presenting themselves to their GP with such a strong family history of prostate cancer, 2 brothers out of 4, and my father, to me is really overwhelming evidence that something should have been done earlier.
I wrote 2 reports about prostate cancer and the inequity in the black population with black males. And yet I speak to colleagues who know nothing about the fact that black men are 2 to 3 times more likely to be diagnosed. And in my area, when we started this, we're 3 times more likely to die.
After I was told about the high PSA reading, things started to happen quite quickly. The earlier on that it's caught means that it's contained within the prostate. You know, things can be done.
The ability to communicate and to ask the right questions, patient can make an informed decision about what they do. And I think being able to make an informed decision is part of the healing process as well.